Welcome back to Power Play. As all of Canada is consumed by that COVID-19 outbreak, the pandemic, at least one province is already looking ahead to when things may return to some state of normality. Saskatchewan is working on a plan to reopen the economy. Is it too soon to even figure that out? How is the province fighting the outbreak in vulnerable areas like long-term care homes? And what about a plan, an aid package from the federal government for the energy industry? Let's find out about all that. Saskatchewan Premier Scott Moe joins us for more. Hope you and your family are okay. Premier, thanks for spending some time with us. We haven't even hit the peak of this thing, a lot of people. Is it too early to be thinking about how to reopen it when there's so much uncertainty, so much quarantine going on?
Well, by reopening the economy in Saskatchewan or segments of it, by no means would that mean we would just go back to how we were operating previous to being hit with this pandemic. We would looking at a phased-in approach, an approach that would have a very robust testing and contact tracing program in place to ensure that we're able to isolate any localized positive IDs that may come up, ensure that we were keeping the people of this province safe, but also ensuring that we are able to operate to some degree the economy here in the province. So it's not a business as usual by any stretch, but we are looking at what this would look like at some point in the future.
Is that a decision that you, as the Premier in Saskatchewan, can make, or are you coordinating that with the federal government and with other provinces? Because I know the Prime Minister's talking to premiers about this. Is this a Saskatchewan-only plan, or is this a Canada plan?
So right now, who we are consulting and coordinating with is our Chief Medical Health Officer, Dr. Shahab, here in Saskatchewan, to ensure that we are limiting the risk with respect to what a plan would look like, ensuring we're doing right, not only by the economic not only by the economy in the province, but most certainly it's one that's guided by best health practices. We've had weekly calls of the Council of Federation over the past number of weeks to share what we are doing in our respective jurisdictions and to align them where we can, so that Canadians are, for all intensive purposes, very similar in the level of restrictions and in the level of changes that we are experiencing in community to community across this nation. We've also had a number of calls, all of the premiers with the Prime Minister, not only about how the provinces are addressing what is a provincial healthcare approach to this pandemic, how they're where the opportunities are for the federal government to support the provinces in that approach, but also how we are going to reopen our economy and grow our, in our case, the Saskatchewan economy, but by broader extension, the Canadian economy, back to all of its prowess like we had it before.
But I mean, time is everything, right? No one seems to know a timeline. But let me get back to the fight that's, the fire is burning. Doug Ford called this a wildfire in places like long-term care facilities. Alberta Premier Jason Kenney said yesterday he's not going to even wait for Health Canada to approve medicine and equipment. If it's already approved in what he calls pure countries, the European Union, for example, and it's not approved by Health Canada, he'll go ahead and apply it in Alberta, go independently. Would you support that? Do you support? Is that a problem with Health Canada?
Well, I'd support any of the provinces in using the tools that they feel they need to ensure that they are keeping their residents safe. Here in Saskatchewan, we haven't had to make that decision yet. We have a lab that has been able to keep up with our testing, a lab within the provincial boundaries. We are also now have Gen Expert testing machines operating in over a dozen communities. We have over 40 different testing locations. We're bringing in some of the Spartan Rapid Access testing kits to ramp up our program, our testing program, which already is the second highest number of tests per capita in the nation, and looking to ramp that up. As if we have any chance of reopening the economy, testing and contact tracing are absolutely paramount for the success of that.
Yeah, let me ask you about that. And you just mentioned the Spartan Bioscience, the Ottawa-based company, and we had the CEO on yesterday, Dr. Lem, and that, of course, is that small kind of mug-sized kit that you put a cartridge in and it gets the results back in an hour. In your view, before a vaccine, and we're getting back to some kind of new normal, sir, do you believe that we will have everybody will have those kits, like every person? You test every day before you go to work, or hospitals or frontline workers? How many of those kits do you envision to get back to a new normal?
Well, we're ramping up our system. We've been doing about 1,000 tests a day, going to 1,500 by the end of the month. We've ordered a number of those kits. I believe we have 25,000 tests on order, another 46,000 through our federal procurement program, and we're ordering more as we speak. Part of the way for all of us as Canadians to get through this is to greatly enhance our testing ability, our capability, ultimately getting to some type of antibody test to buy us some time between now and whenever we can have a vaccine, of which we're hopeful will be produced and developed right here in Saskatchewan at Vito Intervac, and we've invested alongside the federal government in that. So I don't know that we will get to every individual having a testing kit, testing in the morning, testing in the evening, but we most certainly need to ramp up our provincial testing programs so that we can test all of those that may be at risk, may have symptoms, may be in an area where they may have been exposed to this disease, so that we can manage this pandemic until such time we do ultimately have a vaccine.